This video presents declassified and licensed material of the Global Institute of Logic and Cybernetics.
Modern healthcare functions as a reactive system, focusing on symptoms after the point of failure. This approach creates a high-entropy macroeconomic cost center that operates independently of underlying biological reality. The result is a total economic disconnect. Capital flows through global networks without a mechanism to verify if those investments actually stabilize biological states or generate long-term value. To ground this in physics, we utilize viability energy, denoted as E sub v. This metric mathematically defines a living system's stability and its distance from a terminal collapse boundary. Unlike the current reliance on subjective symptom reports, the Life Sciences Fabrica prioritizes the verifiable, systemic stabilization of the organism's trajectory. Managing healthcare at a civilizational scale requires the application of rigorous control theory principles. The LSF Economic Axiom states that capital allocation is only mathematically optimal when it directly minimizes biological instability. This state space model illustrates the core value function. As a digital twin moves towards the blue viability basin, we calculate economic value, V, as the negative change in E sub v. A verified drop in viability energy correlates precisely with positive economic return. This formalization allows us to treat biological viability as a hard, computable financial asset, subject to the same rigor as any other institutional resource. By applying this specific equation, we transform systemic biological instability into a predictable economic yield. We have developed this framework into a modular, industrialized product architecture ready for large-scale clinical deployment. The stack begins with SKU P1, providing data ingestion and interoperability, feeding directly into the P2 delta E sub v prediction engine. The P4 meta simulation and P5 governance layers complete the stack, adhering to strict compliance tracks of the EU AI Act and medical device regulations. Revenue is generated through three primary channels: SaaS licensing for hospital networks, per-outcome billing models, and developer fees for API access. This architecture provides institutional capital with a scalable, revenue-generating ecosystem that integrates directly into existing public and private health infrastructures. Deploying autonomous systems in healthcare requires addressing the critical risks associated with liability and patient safety. Our SKU P3 control policies are restricted by the Omega Governor, an invariant enforcement layer that prevents the system from taking unsafe actions. Using the digital twin meta-simulation, the system tests all proposed interventions in a virtual environment to evaluate their counterfactual outcomes before they reach a human patient. Every action is gated by the kernel gate, which mathematically rejects any intervention that would cause a biological trajectory to diverge from the stability basin. This mathematical gating process is the ultimate de-risking mechanism for sovereign allocators, effectively neutralizing the liability typically associated with autonomous care. These metrics enable the LSF outcome markets, allowing sovereign wealth funds and institutional investors to fund specific, high-impact biological interventions. We price each intervention based on its expected improvement to biological stability, the uncertainty of that outcome, and prevailing discount rates. The settlement flow is automated. After the initial capital injection, the intervention generates a verified drop in viability energy, triggering an immediate payout via smart contract. This outcome is captured in an append-only cryptographic ledger, providing a permanent, auditable trace of biological state change. By utilizing trustless auditability, we align financial incentives with measurable biological stability, removing the possibility of systemic fraud. To scale these incentives to individual populations, we utilize the Health Utility Token, or HUT. HUT functions as a dedicated unit of verified biological improvement, distinct from speculative financial assets. To prevent gaming, tokens are minted only when the system audits and verifies a reduction in a participant's viability energy. Holders can use HUT for discounts, protocol adherence rewards, and transparently allocating resources to research. This tokenized layer provides the mechanism to monetize positive, verified health decisions across large populations. The LSF framework has successfully transitioned from theory into a functioning minimum viable system. Our primary institutional anchor is the Bulgarian Academy of Sciences, which hosts the first operational node for real-world validation. We are currently pursuing integration with European innovation pipelines, like Horizon Europe, to secure non-dilutive funding for regional expansion.